This video will cover Fanconi Anemia, which can lead to disorders of marrow production. To anchor ourselves, we have a fish that looks a lot like a certain character named Nemo from a popular children's movie. And Nemo sounds like anemia, right? The falcon next to Nemo represents Fanconi Anemia. The toy car represents autosomal recessive inheritance of this disease. The TV is set to a well-known channel that sounds a lot like MCV, right? And the TV seems to be playing at a really loud volume. Together, these remind us of high MCV in these patients. Thrombocytopenia may also be observed concurrently, and it's represented by that one single plate on top of the TV. Eventually, these patients can develop pancytopenia, which is represented by that pan next to the TV. The meal from this popular restaurant represents myelodysplastic syndrome, which is often shortened as MDS, and MDS sounds similar to the name of that restaurant, right? This represents the fact that these patients are at increased risk of developing MDS. On a similar note, these patients are also at increased risk of developing AML, which is represented by the AML awareness flag. Probably not as essential to remember, but AML with monocytic differentiation is most likely if these patients do develop AML. Let's move on to that skin product with a cancer ribbon on it. This represents the fact that these patients are at increased risk for epithelial malignancies. The baby on the altar is a symbol for fetal hemoglobin, which is often elevated in these patients. It's too late for them to have posted up this no radical activity sign, but it represents that these patients can have absent radii bones. Additionally, these patients can have absent thumbs. We can just remember this one because when someone does something that is rad, you can give them a hang loose sign with your hand, right? Rad sounds like radius, and you need your thumb to do a proper hang loose sign. It's a stretch, I know, but hey, work with me on this one, alright? Another finding that may be seen in these patients is short stature, represented by the short character here. Microcephaly may also be seen, and while I haven't included a prompt to represent this, we can remember it by his short stature, even though his head appears to be fairly normal sized. Short stature and small head, that's not too bad to remember, I think. I could definitely use one of those that our guy here is drinking. He's got a nice warm latte. The latte represents cafe au lait spots, which may be seen in these patients. Let's move on. The horseshoe here represents renal anomalies, another possible finding. Now, coming back really quick to the falcon. I don't think this will be hard to remember, but Fanconi anemia is associated with mutations in FANCA, FANC-C, and FANC-G in the vast majority of cases. They all start with FANC, so I think it's pretty easy to remember. Maybe this image takes place in South Africa because look, there's a South Africa flag right there. This represents the fact that incidence of this disease is particularly high in white South Africans. The fact that our characters here are white should also clue us into that too. We're getting close to the end here. This one has been a lot. Let's talk about that mythology book. It represents mitomycin C, since both words kind of sound similar. Mitomycin C is one of the agents used in the screening test for Fanconi anemia. This screening test measures sensitivity of cells affected by the disease to DNA cross-linking agents, such as mitomycin C. Affected cells should have higher sensitivity to these DNA cross-linking agents. The next DNA cross-linking agent that can be used in this screening test is diapoxybutane, represented by our propane tank here. Butane, propane, I don't know, I didn't do very well in organic chemistry, so we'll just use that to remember it. The last DNA cross-linking agent and last thing to remember about this disease is cisplatin, represented by the platinum sword on the ground.